Hi, everyone. Welcome. We're just going to give 1 minute for people to come in and get settled, and then we'll get started. Hi, everyone. We'll get started in just a minute. All right, we'll go ahead and get started. My name is Katrina Davis, and I'm the program manager for the Georgia Colorectal Cancer Control Program. And we are bringing this presentation to you today to spread awareness about colorectal cancer. This is a very deadly disease, but it oftentimes is very preventable and beatable if we know the symptoms and if we can catch it early enough. Sometimes we're able to beat colorectal cancer. So we want to share more about this with you today. To get started with a little housekeeping, we'll take questions in the chat box. So if you have any questions for any of the panelists today, just go ahead and drop them in the chat box and we'll answer them near the end of the webinar. We'll also have time for you to ask your questions directly to them if you would like to come on camera near the end as well. We'll have Dr. Koosh Desai start us off today with a presentation about colorectal cancer, the symptoms, some of the screening methods that you can do to identify colorectal cancer, and he'll just get us oriented with the topic. After that, we'll have Ms. Allison Rosen share her story as a colorectal cancer survivor and how she went through this experience in her early 30s. And I'll just give you a little background about both of our speakers today. Dr. Desai is an internal medicine physician located in Albany, Georgia, and he practices with the Phoebe Putney health system. He works very hard to reduce health disparities in Georgia and has lots of expertise in colorectal cancer. He collaborated with Georgia Corps to form the CDC-funded Georgia Colorectal Cancer Control Program, and he serves as the regional medical director. Ms. Allison Rosen is a patient, community policy, and research advocate for the collective adolescent and young adult cancer and colorectal cancer communities. In June of 2012, Allison's life was totally disrupted when a colonoscopy revealed stage 2C colorectal cancer. She has now been cancer-free for 11 years now and volunteers her time in committees for young adults and colorectal cancer patients with groups working on effective patient experience, social media, and outreach initiatives. We're very glad to welcome both of you today, and I'll pass it off to Dr. Desai to get us started.
Very good. Thank you for that introduction, Katrina. And thanks for your leadership with our colon cancer prevention program as well. So I'm just going to give you a little bit of an overview on colorectal cancer, a little bit of background about it and how you can actually prevent the disease. So colorectal cancer is the third most common cancer for both men and women. And it's also the most preventable type of cancer. Regular screening, it can help you remove these things called polyps, which I'm going to explain, and it reduces the risk of developing colorectal cancer by up to 90%. So of the types of cancer, colorectal is very preventable now compared to other cancers. Now, of course, it's very important that you get screening for mammograms for breast and for cervical as well. But colorectal is unique in that it actually can be prevented. The cancer is not only detected early, but it also can be prevented altogether by taking out these precancerous growths called polyps. And so that's why it's so important to get screened for colon cancer, because before cancer becomes a cancer, it's this precancerous thing, this precancerous tumor called a polyp. And so these are just some examples of polyps. So this is what we would be able to see within your colon through screening. The hope is that you get the screening done, you catch these things, take them out, and you never actually develop colon cancer. Now, in some cases, you may even through screening find cancer, but it's going to be at an earlier stage than what you would have done, what you would have caught had you not gotten that screening done. And so this is just another example of a polyp. And this is just through a thing that we call a colonoscopy, which is an image that we get from a camera we put into the rectum. And so again, it's important to recognize that through screening, we can detect precancerous polyps before they even turn into colon cancer. That's one of the reasons it's so important to get screened. The other reason it's important to get screened is sometimes we detect a cancer, but it's an earlier stage cancer than what it would have been had we waited for symptoms, because oftentimes colorectal cancer, especially early on, has no symptoms. And that's one of the reasons that colorectal cancer is so deadly, is that it can grow and you won't even know that it's growing unless you get screened for it. So this is just an example of one way that we screen, and this is and this also tells you, shows you what your rectum looks like. And so this is it's obviously, or not obviously, but many people may not know, this is what the part of the body that absorbs fluid back into the body, and it's also what produces processes waste. And so the rectum is what gets rid of waste after you've eaten food. And so it's just another example of these precancerous growths called polyps that we can remove through colonoscopy that can be detected through screening. So this is just some risk factors of who is at risk for colorectal cancer. So this is staggering when you think about this, but a 1 in 23 lifetime risk of colorectal cancer in men and a 1 in 25 lifetime risk of colorectal cancer in women. There's probably close to 20 people on the call right now. And so of those 20 people, somebody in their lifetime will develop colon cancer. With screening, we can help prevent that, or at least catch it at an earlier stage. And we're also finding that if you're born after 1990 or around 1990, you have twice the risk of colon cancer and 4 times the risk of rectal cancer than those who are born around 1950. So in other words, we're seeing younger people get diagnosed with cancer, which is why it's even more important that our younger people are aware of remembering to get screened when you get eligible, but also keeping in mind what are some of the symptoms and some of the ways to prevent colon cancer. So these are some of the factors that increase risk. And so, of course, these are the things that increase your chance of colon cancer. If you don't do these things, then you can get, then you're at lower risk. And so if you have a family history of colorectal cancer, that's one possibility of what would increase your risk. But also so that's not preventable, but what is, it's important to be aware if you have family history of colorectal cancer, because you would get screened at an earlier age. So it's important to tell your doctor if you have, if you know somebody in your family that has colorectal cancer. But things that are actually preventable would be things like cigarette smoking, things like obesity through eating healthier diets, physical inactivity. Of course, walking and physical activity would prevent colon cancer. And so there are modifiable risks as well. And so it's important to keep in mind, especially for our younger folks, that there are things you can do to prevent colon cancer just through reducing your likelihood of getting it, or reducing your risk of getting it. Other things that you can't reduce the risk of, like family history, or if you have certain diseases, it's important for you to recognize that you have those diseases and recognize that you have that family history, so you can talk to your doctor about what to do next, given that. So symptoms of colorectal, like I said, so younger patients, oftentimes patients get colorectal cancer and they don't know they have colorectal cancer. So the symptoms are there, but oftentimes they come later. But if you do have these symptoms, it is important to get checked out by your doctor. And like we see, so it says never ignore new or worrying symptoms. And so that's the reason that it's so important to know what the symptoms are. So if you have these issues, it's very important that you get checked out by your doctor, and your doctor gets you further tests to see what's going on to make sure you don't have cancer. And so things like this, and so examples would be blood in the stool. changes in bowel habits, changes in the shape and size of your stool, and rectal plane. Now, these are things that a lot of people have, that can have for all kinds of different reasons that are not colorectal cancer. But the thing that we worry about, and the thing we always try to rule out the really bad stuff first. And so if you have one of these, blood and stool, change in bowel habits, a couple other things that are on here would be weight loss that you weren't expecting or weren't trying to lose weight and you lost a bunch of weight. That could be colorectal or another type of cancer. And so it's important that anybody that has any of these symptoms, that they get checked out by their doctor, and it's important that their doctor does some further workup to make sure that they don't have colon cancer. And because oftentimes we think that if we're younger, if you're 30 years old, 35 years old, 40-year-old, whatever, you wouldn't think that you're at risk of colon cancer. But like I said in the earlier slide, younger people are becoming a much higher risk, and actually compared to their older peer or their older generation, they're actually more at risk for colon cancer. And so in other words, the average age of colon cancer is going down because of the younger population now developing it that we didn't see before. So what should I do if I don't have any symptoms of colon cancer? Get screened. And so this is important. And so you can just think so one of the questions I always ask is, what age do you get screened for colon cancer? And so a lot of people think it's 50. Actually, because of that fact that I said that younger people are now getting colon cancer at higher rates, it's actually now 45. And that's for every patient of average risk, that an average risk meaning you don't have a family history. Now, if you have a family history, the number would be even younger. And so you have to keep in mind, just kind of think back and, okay, do I have a brother, a sibling, or a parent, a grandparent that has had colon cancer? If they have, then you need to get checked out by your doctor, and the doctor can help you work out we have to do ask some more history questions. And so we can tell you what age you need to get screened, but it's going to be earlier than 45. But the latest age that anybody should get screened is age 45. So if anybody that's on the call that's 45 and above that has not been screened, it's very important that you talk to your doctor and get a screening. So when I keep saying screening, what do I mean by screening? And so these are some of the methods that we use to get screened for colon cancer. So these are things that we use to help detect markers within your stool, or for us to directly visualize the rectum and the colon, for us to know whether you have colorectal cancer or whether you have a polyp, which, remember, the polyp is a precancerous growth. So this is before you get colon cancer, and you get these little growths that turn into colon cancer. And so some of the tests that we use are FIT test. So FIT test is a little strip that you just put a little stool on. You do it every year. And that'll let us know whether you have a certain product, a certain thing in your stool that we think looks harmful. And so, for example, if you have a colon cancer or even a large polyp, you can get heme, which is a byproduct of these things that we don't want in your rectum, and that'll show up positive on the FIT test. So that'll let us know that if your FIT test is positive, you have to then go to a colonoscopy, or you can do, and so that's every year. The Cologuard, which is similar to the FIT test, but it tests for some additional markers. You do that every 3 years. Or you can do a colonoscopy, which is once every 10 years. Now, the thing to remember is the FIT test and the Cologuard are at-home tests. You just do them, and if you're positive, that means you might have something in your rectum or in your colon that we have to take a look at. And so then you would have to get the colonoscopy. The other option is just to go ahead and get that colonoscopy to begin with, and that'll let us know directly just through that camera that we're looking at whether there is a precancerous growth or there is a small early cancer in there. And so that's why these are some of the options. And so as far as what's the best one, well, it really just depends on what the patient prefers. I mean, there's cost considerations, there's time off of work for some of them required, like for the colonoscopy, you have to do a bowel prep and get some time off work. And so for that reason, you have to talk to your doctor. And none of these tests you can't just, where we wouldn't just recommend you just to go online and order a test, because it's important that the doctor decides which test is best for you based on your preference and based on what your conversation with your physician. And so some other things are CT colon, it's like a CT colonoscopy, and then a colon capsule endoscopy. And so these are things that sometimes, if patients don't want to do the other three, sometimes recommend those, but we really in practice, we get most of our patients, and I get most of my patients to do one of those other three. And so, like I said, the age, when do we start screening? So for average age patients, so for most people, it's going to be 45. And so if you're 45 and you haven't been screened, it's really important that you get screened so we can catch that cancer early and prevent you from actually getting cancer altogether. And so, like I said, it's a recommended frequency of different tests. So like I said, with the FIT test, which is that little card that you just put a little stool on, that's going to be every year. The other one is that bigger thing. You might have seen the advertisements with the colon, the guy, I forgot his name, but the for Cologuard, but that's going to be every 3 years. And then for colonoscopy, it's every 10 years. Now the intervals can be different based on your individual needs and history, but that's typically what we do. And so it's, remember, once again, if we don't remember anything else from this conversation, it's the age is 45 for most people. And so it's very important to recognize we're seeing colon cancer at much higher rates in younger people, and that's why it's important to get screened at 45 now. It used to be 50, but that's no longer the case. Like I said, if you have family history, it's important to talk to your doctor, because you're probably going to need to get screened even earlier than 45. So 45 is the latest you would get screened. And then how would you get screening tests scheduled? Again, you talk to your doctor. You can go to your primary care. If you're in East Georgia, you can go to East Georgia Healthcare Center. If you're in the other part of the southeast part of the state, southwest part of the state, you can go to Albany area primary healthcare, or you can go to Phoebe Putney primary healthcare. And there's some of the ways around the state, but the important part is get your primary care doctor involved. If you don't have a primary care doctor, you should get a primary care doctor so they can help you stay on track of your colorectal cancer screening, but also all of your other screenings as well. And there's no excuse to get screened for colorectal cancer. All right, so I'll stop right there. If anybody has any questions, actually, you can save your questions for the end, because Allison's going to be up next, and she may even answer some of the questions you've had. So Allison is a great advocate for colorectal cancer screening. I've worked with her on several projects, but I've seen her all the time at colorectal cancer national meetings, and so she's a great advocate and a great resource for colorectal cancer prevention. So Allison.
Okay, give me a second and I will share my screen. Okay, can you all see that? Okay, perfect. Well, thank you so much, first of all, for allowing me to join this meeting and tell a little bit about my cancer story. My name is Allison Rosen. I am almost 12 years of a colorectal cancer survivor, stage 2. And now I've transitioned to be a very passionate advocate in helping support patients, research, and policy initiatives. I'm going to tell you a little bit about my story today. I'm an open book, so if something comes up and you have a question about it, besides what you just heard, feel free to ask away. I was actually working in cancer research at the time of my diagnosis. I had worked in cancer research for about 5 or so years. Started having unusual symptoms to me. Now, a little bit about me is I have a history of Crohn's disease. So I had a GI doctor. I was getting screened regularly. I was in remission from my Crohn's for about 5 or so years. I had a very clean, probably the cleanest colonoscopy I'd ever had in my life, a year and a half earlier. But I started having unusual symptoms for me. So some that were mentioned earlier that were apparent to me were unexpected weight loss, severe fatigue. I thought that was because I was doing Zumba all the time, because I was in the best shape of my life, happy and healthy. But apparently it was not. The biggest symptom for me was change in bowel habits. And when I ate, it felt like something was stuck inside me. And unbeknownst to me, that what was stuck was a tumor. There was a 13-centimeter tumor in the bottom part of my colon and into my rectum. So I always call myself a colorectal cancer survivor. And a colonoscopy saved my life. I told my GI doctor about my symptoms. I wasn't scheduled to have a colonoscopy for, I think, 6 or so months. And so because of me being adamant that something was wrong, she moved that up. And I had a colonoscopy. I remember waking up from the colonoscopy and her saying, well, Allison, we found something growing inside you. We don't know what it is. I don't necessarily think it's cancer, but I'll know in a few days. And so that was what I was left with that colonoscopy. She had mentioned cancer, and it was a little bit scary. Somehow I had to go back to my life. I worked in a research lab across from her office. So, the next 2 days were kind of a little bit of a blur, me trying to work. But 2 days later, she called me and asked if I could come to her office, and she had some news. And at that point, I knew my life was about to change. And it did. I walked to her office crying on the phone to my mom. I was 32 at the time, so I forgot to mention that. So I was younger, but again, I have a history of Crohn's, but still I have a lot of friends that are younger that are getting colorectal, and I'll talk about that in a little bit. But yeah, I was diagnosed in June of 2012, and one of the first pictures from my cancer journey is one that's on the screen right now of me wrapped in a blanket. My dad took it after I had one of my first of many surgeries, and I use it to show the trajectory and how far I've come, because I go to the next slide. So I have had throughout my cancer journey 4 abdominal surgeries. My treatment included radiation and oral chemotherapy. You can see me, I lost my hair, which isn't necessarily the most common. Colorectal cancer patients don't always lose their hair. I did, because my cancer was very bad in combination with my Crohn's. It was just a very hard experience for me. I had oral chemotherapy and radiation. I ended up ultimately, after my last surgery, with a permanent ileostomy, which essentially, when they went in to do surgery on me, they had to take my whole colon out due to years of disease of my Crohn's. They took the whole colon, gave me a temporary ostomy, and essentially they take part of your inside, sew it to your outside, and they put a bag on it. So essentially, I pee normally, but everything else goes to a bag attached to me. You wouldn't know if you saw me, and you'll see some pictures of me. So it's not like it's obvious that I have an ostomy, but my life sort of changed forever. And I had this preconceived notion that an ostomy would be the end of my life. And now I know that it was the beginning of my life after cancer treatment. And I am very adamant and very open and talk about life with an ostomy regularly to people that are thinking about potentially or considering having one, or their doctor suggests they have one. So I went through my treatment. It was a course of probably about 3 or so years. And then I was considered a survivor. And then I transitioned into survivorship. Survivorship is something that often isn't talked about a lot. Again, due to all the treatment that I had, I started experiencing symptoms that were unusual for someone my age. So 35, my cognitive ability was affected. My everyday job working in a research lab, I couldn't remember a simple polymerase chain reaction. I couldn't remember a simple procedure that I had done for 7 years in the lab. So my ability to remember things was highly affected. They call that chemo brain. And it's still not 100%. So ultimately I didn't have to, but I decided to transition jobs just because it was very frustrating not being able to do the things that I did before. One thing that often is talked about in the first appointment, no matter what cancer you have, but especially with colorectal, if your radiation or chemotherapy are on the plate for your treatment, is fertility. At the time when I was treated, there wasn't a fertility specialist where I was treated. I did, though, ask my doctor about fertility preservation, and I went through the process of learning about it. I had medicine ordered and was about to go through the process of freezing my eggs, but unfortunately, the day before I was going to start the 12-day process, I got really sick. Blood was just coming out of me. And I ended up in the ER, and my surgeon and oncologist and I decided I needed to start my treatment. So one thing to note with colorectal cancer being preventable through screening for a lot of people is all the loss that has come to me, and again, so many others due to cancer. Infertility is one of them. So I'm never going to be able to have children of my own due to cancer. Although I know there are other options, fostering, adopting. I am the best aunt ever. I will say that. Don't tell my sisters, but I have a beautiful niece who I love and spoil every day. But just some of the things that cancer takes away, I just want to, bring them to the surface so you all sort of understand, and it's not just chemo radiation, it's a lot of long-term effects. I also went into menopause as a result of my treatment. So a few things I want to focus on, and there's a lot less words on the rest of these slides, and I want to highlight the things that got me through my cancer journey and also helped support me now, even almost 12 years later. So one of the most important things to me was being close to family. I live in Houston. My parents are in Houston. And so I couldn't have gone through my cancer journey without my parents are in the center along with my siblings. My siblings do not live in Houston, although they came to Houston quite often. But when I wanted to escape, I'd go visit the one that lives in New York or one that lives in San Francisco, and my brother lives in Tokyo. So everyone's kind of all over the place. But when it came down to it, when I was going through my treatment, people would come together and be there for me and my parents, who were my caregivers during my treatment. I have a picture of my 2 cats because support animals when you're going through health issues. Everyone knows dogs, cats, even if you have a bird, whatever it is, really, they understand you. They love you unconditionally. And for some reason, they know when you're crying that you're upset, and they come and make everything better. Other pictures, my niece that I'm holding in the other picture, she is my heart and soul. She's spoiled. If she says she wants something, I will give it to her. And I think family is so much more important to me now that I've gone through cancer. I really treasure every moment I have with them. So if there's an opportunity to do something where we all get together because we also are so far away, I make sure I'm there and present, and just, again, treasure every moment. The other thing that I leaned heavily on were friends. And some of these friends are new friends. Some of them are from growing up, and some of them are from during my cancer treatment. But ultimately, what I found out was, being a young adult, an adolescent young adult, when I was diagnosed with colorectal cancer, the first thing I asked my doctor for, besides psychosocial care and other things, was another survivor to talk to, like myself. This woman who didn't know me sat down and talked with me for a few hours before I went for my first surgical consult. I went in to MD Anderson. I, talked about treatment, but I needed to talk to someone that understood what I was going through. So I talked to one person, and that person got me involved in advocacy. And that led to me being an advocate for a lot of different nonprofits, and being able to share my story, in the state, globally, all over, so other people understand the importance of screening and early detection. So a lot of these friends are people I've met throughout my cancer journey. And, they come from all walk of life, but the thing that a lot of us have in common is we've either lost someone to cancer or we've been affected by cancer ourselves. So life after cancer. I know I said, and I talked a lot about survivorship and all the things that I've gone through. Yes, I have an ostomy. Yes, I have, I'm in menopause. Yes, I lost my hair. My hair has obviously grown back. A lot of the physical things are, some of them, there are challenges I deal with every day, every year, but ultimately I wanted to make a difference in my life. And so I decided to transition from cancer research into advocacy and public health and community outreach and education. So not only was my job more fulfilling, my life was more fulfilling. I had a purpose after cancer. And so I started doing advocacy. Again, I moved from cancer research to working community outreach and education at the cancer center I was at. But I've had the opportunity to share my story to, truthfully, if anyone that will listen, I'll share my story. But some highlights here are, I teach second-year medical students every year when they get to their curriculum related to colorectal cancer. It started out as a 15-minute talk, and now I teach a whole class because I really go through my cancer journey, and I want them as future providers to better understand, no matter what field they go in, what they might encounter. They might, if they're in gynecology, they might have a woman that has bleeding. If they in primary care, family medicine, you never know when you're going to run into somebody. So really understanding that if you have a colon, you're at risk. And if someone comes to you with certain symptoms that were mentioned earlier, you got to listen to them and make sure they get access to screening. I turned the city of Houston blue and get a proclamation in March declaring Colorectal Cancer Awareness Month. I've had the opportunity to testify in the Texas Senate, in the House, and then in DC regarding colorectal cancer screening initiatives. I helped testify about lowering their screening age in the state of Texas to 45. So very happy that Texas is one of the states that passed that. I never thought I'd be in Times Square anywhere, let alone talking about poop and colorectal cancer, but I had the opportunity to be featured in Times Square and talk about the importance of screening and early detection. And one of my favorite pictures on here is my prop that I bring everywhere that I can potentially make it to, mainly local, a giant inflatable colon. So we have a giant inflatable colon here in the state. And it's a great tool to better understand, to better explain colorectal cancer, Crohn's, colitis, diverticulitis. So I bring it because it's 20 feet. It's huge. You can see me, you can see the colon. When you have that out, people flock to you and they learn about the importance of screening and early detection just by walking through it. There's information on it. There's diagrams on it. And so it's one of my favorite props to use no matter where I am if I'm talking about colorectal cancer, because people want to know more. What is this large pink thing in the middle of the Texas Medical Center? Because that's often where I have it. And then, besides my advocacy, besides when I said family is important, advocacy is important, I've really learned the meaning of life and not saying no to any opportunity that comes my way. So I had the opportunity a few years ago to go on my dream trip to Africa. And you can see the picture of me with zebras is on a safari in Africa. And I probably would have delayed that or not really taken the time out of my, my day, my year from work to do something that meant so much to me. I climbed a mountain. You can see my hands up with my ostomy. And for me, again, I thought when I had my ostomy, my life would be over. I wouldn't be able to exercise. I wouldn't be able to do all the things that I knew and loved. And it was exactly the opposite with my ostomy. It allowed me to climb that mountain. It allowed me to show the world that you can do anything with an ostomy. I've gone in the bottom surfing with a group of cancer survivors for National Cancer Survivors Day. I went skydiving. The only time I will probably go skydiving, it was fun, but I don't want to do it again. But I can say I did it celebrating myself and all the other survivors in that picture on National Cancer Survivors Day. Zip lining, and again, more hiking, because really I try to, push myself. I'm also now the healthiest I've been, and partially that is due to my ostomy. So another thing that I've embarked on, and I've always been active on social media, but when they lowered the screening age to 45, and it was COVID times, and I had a lot of free time because I wasn't going out and about and traveling like I used to do, I decided I wanted to do more. So I'm on Instagram, I'm on Twitter, I'm on Facebook, but I decided to explore TikTok, because if you see 1.05 billion daily active users, I was like, okay, well, maybe I can do dances or point and help dispel misinformation that's out there, because you got amazing information earlier, but there's a lot of bad information out there. If you look on Google, or especially if you look online, and I got horror stories about ostomies. So that was part of the reason why I didn't want one at first permanently. So I wanted to ensure that there were more voices out there talking about the importance of screening and early detection. And I can't tell you how often I would go to community events and talk to people about colonoscopies, and they'd be like, I'm not doing that. That's horrible. I want something stuck up my butt. I don't want to do that prep. And then I'd say, well, a colonoscopy saved my life, and it could potentially save yours. And that's a comment I got after I made one of my TikToks. Same thing, like educating people about the various preps that are available, the various screening options that are available. So I got on TikTok with no expectation, and now about 20,000 users or followers later, I still am educating about colorectal cancer, screening, early detection, ostomies, clinical trials, anything related to cancer that I've gone through and have experienced, because I really want people to know that they are not alone. And it's one of the things I enjoy the most, educating and, again, trying to dispel misinformation. So find the reliable sources on social media and and follow them, because they will, everything I post is a fact and comes from CDC, NIH, NCI, ACS. So I just want to make sure there are more voices out there that are telling the correct story. Oh, and there's one of my TikTok. Can y'all hear?
No, can't hear it.
I forgot that it was playing. I thought I just put an image there. But either way, using social media is a great avenue to educate. And it's, again, one of my favorite things to do. When a new stat comes out, I'm the first to be like, okay, I need to get it out there. When a celebrity comes out doing a colonoscopy, I'll post a video of them doing that, because, you know, I know my story is important. Everyone's story that's gone through cancer is important. But, you know, when you see a celebrity getting a colonoscopy, oh my gosh, maybe I should do that too. So with that, I'm going to stop sharing and just say thank you so much for allowing me to share a little piece of my colorectal story.
Thank you, Allison. That was awesome. I really like the pictures. I kind of want that toilet seat prop. I'm going to start using that one too. So, does anybody have any questions for Allison? If not, I'll have some questions myself. Was there anything in the, so if you have any questions, you can always put them in the chat box as well. So my question would be, what would your message be to somebody going through, well, for one, I have patients all the time that just don't want to get the prep. What would your message be, or what do you tell patient, or just don't want the procedure at all? What do you typically tell people that are in that position? Like, how do you, because you've been through it, so how do you fix them?
Well, I mean, when someone says, I don't want to have a colonoscopy, I say, listen, if I hadn't had one, I wouldn't be alive today. It's 2 days out of your life versus years of dealing with cancer and long-term effects of cancer. And I also say there's a lot better preps than there were 12 years ago. So I give them the prep option. So like, it used to be, my first colonoscopy I ever had was that 4-gallon prep that you had to drink. There's now pill options. There's now like Miralax and Gatorade. There's small, low volume preps. So I say, listen, see it as a colonic, see it as you're getting a clean out. You're going to lose some water weight. That one procedure potentially could save your life. And if it's clear, like you said earlier, you don't have to have another one for 10 years. And I also sort of use the family. I say, do it. If you don't want to do it for yourself, do it so you can be at your son's wedding or your daughter's graduation or this or that. Like, you're doing it for yourself, but you're also doing it for the people that you care about the most.
That's awesome. Yeah, thank you. That I will definitely use that. So I appreciate that. Katrina, do you want to lead the find some more questions and stuff, or do you want me to? I think
yes. And thank you for sharing your story, Allison. I've heard it a few times and I still get emotional every time listening to it for so many reasons. But you know, stories like yours are so powerful because you, not only did you go through this and you have this lived experience, but you're now using your voice to advocate and share more about it and save so many lives just by telling your story. So thank you so much. It gives me chills, and continue the great work that you're doing. We have a couple questions. Let's see. Give me 1 second. Which diseases are known to put people at increased risk for colorectal cancer?
That's a good question. So Crohn's is definitely one of them. Ulcerative colitis is another one. Like I said, if you have family history of colorectal cancer, that's definitely also puts you at risk. There's other diseases as well. I mean, there's FAP, which is familial adenomatous polyposis. And so that's a disease that actually almost everybody with that disease eventually will get colon cancer. But that's something you would know early at a much young, when you're like a kid. That's when you would start getting screened for that one. Those are the main ones that I can think of off the top of my head that you would get that would put you at risk in terms of actual diseases. Now, like I said, there's obesity. I would consider that a disease as well. And so obesity also puts you at a risk for colorectal cancer. So that'd be another one. So
okay, thank you. And this question is for Allison, but both of you can answer if you would like to. The question is, what do you think about the approach that the UK is taking for young patients with GI symptoms to give them a quick stool-based test so as not to delay waiting for a colonoscopy?
Yeah, I mean, in the US, a lot of people are doing stool-based testing as well before colonoscopy because you can't screen everybody. First of all, you can't screen everybody 45 and up with colonoscopy. So we're using a lot of like the FIT, FOBT, Cologuard tests before we do colonoscopy. But ultimately, I mean, I think it's great, obviously, as a young onset survivor, but someone that also works in the field as well. We can't screen everybody because then we would clog the system. So there has to be some sort of method. And I do think that the education and awareness about symptoms, family history, and all these genetic conditions that were just mentioned are sort of, I say, should be prioritized, and they should get a FIT or, you know, a stool-based test first before they go to colonoscopy. I mean, if there's rectal bleeding, obviously straight to colonoscopy. So, I mean, I think my goal in advocacy is to empower people within the community to speak up. If something doesn't seem right or they have one of the symptoms, to speak up. And the stool-based testing is easily accessible and affordable. You can't just go get a colonoscopy. I mean, you can get a colonoscopy out of pocket, but it's very, very expensive. And, you know, insurance won't necessarily cover it unless you're of a certain age or you have a specific condition. So if you can get one of these stool-based tests and it's positive, then you qualify to get that colonoscopy. So, you know, I think the other thing that's coming out or is on the horizon as I've attended meetings is blood testing. So they're doing a lot of research. A lot of pharmaceutical companies are trying to figure out a way to use blood to test for different things, DNA and RNA, that might pick up something, you know, something that would qualify them to also have a colonoscopy. So I look forward to when there'll be multiple different options for everybody to be able to get, and it'll just be as a part of your physical, you get a blood test or you get a stool-based test. It's just a part of everyday screening. You know, I think that, again, and you know, I know that Dr. Desai can speak about this as well. The system is just, there's not enough capacity to screen everybody. So if they have a system that's worked and they have, you know, the capacity to screen everybody that's positive for, you know, maybe a stool-based test and get them to colonoscopy in the right amount of time, then I think that's, you know, if that works for them, great. In the US, I know we don't have that capacity yet. That's why, like, the awareness and making sure younger people know about the signs and symptoms and their family history is so important, so they can talk to their doctor. So I'm educating the patients, but then also healthcare providers need to know. So not everyone's as educated as the people on this call, because healthcare providers need to know that if someone young comes in with these signs and symptoms, they need to give them a screening test.
Yes, absolutely. Especially so many people being diagnosed under 45, you know, they're not going to have that standard screening. So that's
Yeah.
important. We do have a question for Dr. Desai. The question, and it kind of relates to what Allison just answered, but the question is, what if you are over 45, born before 1990, and have no symptoms or risk factors other than being African American? It seems as if colonoscopies are being emphasized here in Atlanta. I can even schedule one by phone without seeing a primary care provider or a GI doctor first. What would you recommend for someone in this situation?
Yeah, that's a really good question. So the three modalities that I showed and that we emphasize in our program and I emphasize in my practice is colonoscopy, but also Cologuard and FIT. So the Cologuard and FIT are stool-based tests, so you don't have to take time out of work. You just do a stool sample. For the FIT, it's a small little card. So that one's just once every year. The other one, the Cologuard, is a bigger sample and they test for more markers, so that's every 3 years. And so if you can't get, or if you, I can answer it both ways. If you can't get a colonoscopy because it takes too long, or you don't want to get off work, FIT is a very reasonable alternative, or Cologuard, both very reasonable alternatives, and they've done studies, and the person years gained. So one of the things that we measure is, if you get screened, how much life, I mean, or how many lives are you saving essentially by getting a certain number of patients screened. And so we're saving essentially, if you get the FIT test every year, and that's where it's kind of hard, because sometimes it's easier just to get something out of the way and you're done for 10 years as long as it's normal. versus chasing something every year. But if you do get screened every year with that little card, it's pretty much just as good as a colonoscopy. It's very close. So let me put it that way. So your benefit and your effectiveness in preventing colon cancer is very similar to a colonoscopy. Now, not all I don't do colonoscopies, but sometimes people that do colonoscopies are very pro colonoscopy. And part of the reason is because and it's true, you can actually, with the colonoscopy, in addition to being done for 10 years, you can actually see the precancerous lesion. And so those cards that you do every yearly aren't the best at detecting precancerous, or not as good at detecting precancerous lesions, although those, if you do them every single year, the chance of detecting something that's precancerous goes up every single time, and so every year. So in that way, it does help. But the colonoscopy will prevent those precancerous lesions as well. But I think it's perfectly reasonable. I think it's appropriate to get either a Cologuard. If you have insurance, Cologuard is free. If you don't have insurance, you can get a fit test, which is pretty inexpensive. Those have to be scheduled through directly to your PCP, but I think those are super reasonable alternatives. So,
Great, thank you. And we have one more question. The question is, do you have any tips to make colonoscopy preparation less burdensome?
Oh, that's really funny, because the majority of my TikTok is focused, at least over the past 6 months, on colonoscopy prep tips, because that's the biggest thing people want to know. They don't want to do it, so how can they make it less burdensome, so yeah, I mean, just off the top of my head, but if you're on TikTok, even if you aren't, check it out, because I have a whole list of different things for myself and other advocates. But I think knowing your prep options. So you don't have to, again, do that 4-gallon one. There are many other options. If you can't drink, there is Sutab. It's a pill. There's less volume. Miralax and Gatorade is less volume, and you mix the Miralax with the Gatorade, it tastes like Gatorade, because a lot of people can't handle the prep because it doesn't have a great taste. I'm not gonna lie, it's not the most pleasant thing. So the Miralax and Gatorade tastes like, and it's over the counter. Your doctor will tell you exactly how to do it. I'm not a physician, so there's different people have different rules or different steps that you follow. But with that, it tastes like Gatorade. There's low volume preps, like lots of options for low volume. One's called Clenpec, Sue Prep. There's one called Soufflave that just came out. There's so many different options. So talk to your doctor about options. Number 2, which always helps me, is I can't drink a lot. I still do the colonoscopies, but I get nauseous when I drink a lot. So I always ask my doctor for a prescription for anti-nausea meds. Always ask for that. I always get it. It's part of I think every GI doctor will give you that, but I always ask for the anti-nausea meds. A few other things I do is sometimes it's better to drink out of a straw. Sometimes I hold my nose when I'm drinking. Sometimes I pretend like I'm taking shots. Sometimes I will always have like gum or some hard candy next to me. So as soon as I drink, I put that in my mouth, so I get that gross taste away from me. But if you put the straw in behind, it's not affecting your taste buds. And the other thing, I mean, again, those are just a few things. The other things that I'll do, and chasers are great, is sometimes you can mix your colonoscopy prep with like Crystal Light or flavoring. It just depends. Every prep is a little bit different. For me, I can't have Crystal Light anymore because I've had too many colonoscopies with Crystal Light. So I don't necessarily do the flavoring, but some people, it's no big deal for them. The other things that I say, that what comes in must come out. So when you are, you have to stop eating at a certain time and then do clear liquids. If you eat like a large pizza at midnight when you have to stop, all of that has to come out. So it's less burdensome. There's less food that you'll have to, get out. So think about, like, I do clear liquids for a day, but then I do like a low residue diet for a few days leading up. So I eat light, and I definitely don't eat like a heavy meal an hour before I have to stop all solid food. So I think leading up what you eat, it'll be less difficult. The other thing is you're going to be going to the restroom quite a bit, and there might be some burning because essentially it will become liquid. So some people swear by Vaseline, putting Vaseline getting soft toilet paper. Some people suggest using a bidet. You can get a little bidet attachment to your toilet that will spray up, that will help combat the irritation that you might get from going to the bathroom quite a bit. And those are just like, again, a few of the tips that I can think of. For the past year, I've just been giving, making TikToks, pointing and saying, here's a tip, here's a tip. And again, having other people that have gone through it. I've had probably 30 colonoscopies in my time, so I've had quite a few. And again, it's never the best experience, but I know, psychological too, I know that I get through this. Again, I'll lose a little bit of water weight. I can have a meal afterwards, but this could save my life. And I think that mentality and being distracted by a TV show or something else, and then just drinking it like, I'm drinking just a regular drink, is what helps me a lot. That was a really long-winded answer.
Those were great. We need to like make a poster and put the tips up because I feel like that would encourage people to, just let's give this a try. If I can do all this to make it a little easier. So thanks for sharing. Before we wrap up, just another question, Dr. Desai, about family history. For those that may have had a direct family member diagnosed with colorectal cancer, when do you suggest they start their screening? Do you have a certain time frame interval that you suggest, or is it on a case-by-case basis?
Well, it really is case, but this is why it's like important that like I would have to ask, like you would have to ask the patient when their first of all, which relative had, because if it was like a cousin or something, we really don't consider that a first degree relative. So it has to be a first degree relative. And then we usually do 10 years before whenever that first degree relative got diagnosed with colon cancer. And so if your first degree relative, which is your dad got colon cancer at age 40, it would be age 30 for you. And so that's, so we would have to, that's why I don't like just, it's better if you just talk to your doctor, if you have a history of somebody in your family, so that way they can kind of sit down with you and kind of figure out when you need to get screened. But typically it's 10 years before the age of onset for your first degree relative. So, and it's usually with a colonoscopy. We don't usually do one of these other stool-based tests. But again, like it's very patient specific too. There have been cases where I've had to do that, a stool-based test, even for patients with the family history. And so it just depends. But the preferred method of screening is colonoscopy for people with family histories. So.
Yeah. All right. Any last questions before we close out? All right. Well, thank you all so much for joining us today. Thank you, Dr. Desai. Thank you so much, Allison, for all the time that you put into preparing for today. We just want to continue to spread awareness about colorectal cancer far and wide, so that we can continue fighting this and making sure that if it's there, we can catch it as early as possible and save lives. So thank you all for joining us today. If you want to learn more about any of our initiatives, I'll drop the link in the chat again, and we look forward to seeing you around. All right. Thank you.
Thank you.
All right.